Discover the latest health tips, expert advice, and inspiring stories. This is the Health Channel Podcast. Your journey to better health starts now.
Sports is an incredible part of a teenager's life, from building friendships to learning about adversity and learning discipline, and also, of course, just promoting physical fitness. But with all of that excitement and in the competition, there's also the risk of injuries, from spraining your ankle, on the soccer field, or maybe spraining a muscle on the football field, or concussion on the basketball court. Injuries are just a natural part of team sports, and it's something that parents, coaches, and teenagers are faced with. Today, on this episode, I'm going to discuss the most common injuries, how to prevent them, and the causes of these injuries on the next episode of Ask the Doc. Hi, I'm Dr. Scarlet Constant, founder of Constant Care Pediatrics here in Miami. Today, welcome to Ask the Doc. This is a show where we encourage you to send in your questions via email, Facebook, or on the All Health TV app, and I will answer them in real time. So please send your questions on this episode of Ask the Doc. It looks like we have a question coming in already from the All Health TV app. This question is from Ignacio. Hi, Dr. Constant. I played sports all year round growing up, and I remember my coach always telling me to stretch before the game. I always did, but why is it so important? Well, Ignacio, I'm glad that you listened to your coach, because your coach was right. Before games, you absolutely do need to stretch, and that's in order to not only warm up your muscles, but get your muscles to be a little bit more flexible. Flexibility will prevent against injuries such as ligament tears or ligament strains. And so stretching before, and don't forget, you also want to stretch after. So after your muscles are nice and relaxed and they're heated up because you've been playing and it's released a lot of lactic acid, you then want to stretch again before the cool down period so that your muscles don't tighten up. So good job listening to your coach, and please encourage your kids to continue stretching before and after practice. Looks like there's another question coming in from Facebook. Hey, buddy. Bunny says, Dr. Constant, my boy Lance plays football and baseball, but he also likes to have fun off the field, if you know what I mean. Having said that, I've been hearing a lot about how important sleep is for teens. Why is this the case? Well, we've mentioned it before. Sleep is important for many reasons. Not only does it allow the brain to solidify all that has been learned and solidify memories, but also you're releasing growth hormone during that time. And growth hormone is essential for the adolescent growth spurt that occurs during puberty. So your teen who is actually going through puberty and exercising and playing sports needs sleep, not only to continue to solidify these things, and not only to secrete the growth hormone, but also in order to rest the muscles. After competitive sports or practice or games, you need recuperation time for your muscles to actually relax and to regroup and repair. There are kind of micro repairs that occur overnight. So this is very important in order for you to be able to play the next day and to continue with your competitive sports. Another question is coming in. Seems like this is just a very important topic to a lot of parents. Polly says, hi, Dr. Constant. I have 2 kids, a boy 12 and a daughter 10. Both are into sports, big time. Johnny plays basketball year round on school and club teams, And Juliet, however, plays soccer in the fall and tennis and swimming in the spring. Is there more wear and tear on the body playing one sport year round versus playing multiple sports? Or perhaps it's the other way around. I'd love your thoughts. Well, it is actually more beneficial to play multiple sports. And the reason for that is, as a growing teenager, you want to be able to work on various muscle groups. You really don't want to train just one single group that's going to be trained during one single sport. So for example, in basketball, maybe you're using a lot of your thighs and your knees for jumping, but then in swimming, you're using shoulders and arms and back. Gymnastics, you're using your core. So again, it's very important for your child to learn how to recruit the different muscle groups and train and build the different muscle groups as well as their coordination. And that will make an overall well-rounded athlete. It's also important to play multiple sports rather than focusing on one, because that way you will prevent overuse injuries. An overuse injury is an injury that occurs because the same group of muscles and ligaments are being used over and over without rest or repair. Remember, we discussed sleep and repairing and recuperation. But if you're not recouping, then you're constantly using the same group. And over time, you're more susceptible to injuries due to overuse and inflammation. So I highly encourage, if it's possible, for your kids to play multiple sports during a school year. Welcome back. It looks like we have a question already. This question is from Evangeline. Hello, Dr. Constant. My son, Trent, plays football for his high school team. They're really good and have competed with some of the other top-ranked schools in the state. My fear is that there seems to be a surge as of late in the number of injuries in high-level competitive sports. What do you think is causing this? Well, I'm not quite sure if there's an actual new onset surge in injuries, but I will say that the higher level or sport you're playing and the more competitive, there's of course more of a risk to injuries. There are a few reasons for this. First of all, in the high school level, you have, again, an adolescent growth spurt. So you have kids, let's say your son, for example, that is having a rapid growth. For being a 14-year-old boy to a 17-year-old young man is a very big difference. You're growing quickly, you're getting much heavier and much taller before your body can actually acclimate. So what happens is the body is a little off balance. Sometimes you might even see these boys as being a little bit clumsy. Imagine 1 year you're playing with a body that's 5'7", maybe 120 pounds, and then in no time you're 6 feet tall and 170 or more. And so the brain has to actually catch up and learn how to retrain the body, control the body to be coordinated and to manage this balance. And remember, they're also off center because they're growing so fast and gaining weight so quickly. So this lends itself to injuries, maybe from falling or not being as coordinated or not having a good reaction time to other players. Another reason for injury is because you have something called the late bloomer meets the early bloomer on the football field. So while everybody's on the varsity football team, as we know, these boys all go through puberty at different stages. So while one might have bloomed earlier and looks like a young man, the same player in his cohort might look much younger and have a body of a much younger child. And those two are matched up against each other because by age, they should be playing together or against each other. And this also lends itself to maybe injuries. You know, one person might be stronger than the other or have better balance or coordination. You're just unmatched at that point in your life. And finally, another reason why there might be high incidence of injuries in competitive sports is because we have to make sure it's not always, but sometimes the rules and regulations of the games are not enforced. For example, some leagues will say in lacrosse, for example, no checking is allowed. In soccer, you can't head a ball until you're 12 or 13 in the girls' league. In hockey, you're not allowed to check. So in football, there's like high speed spearing the ball. So these are things that the refs and the leagues are supposed to keep within range and within normal limits and follow these rules to prevent injuries. So before your child plays a sport or joins a league, you also might want to investigate and make sure that it's a league that really does enforce a lot of the safety rules and regulations that are implemented to prevent these types of injuries. I hope that was helpful. Let's see, we have another question coming in. This question is from Earl. Dr. Constant, my son, little Earl, is athletically inclined and looking forward to playing Little League Baseball and joining the local club hockey team. What are the most common sports injuries amongst kids and teens, and how can they be prevented? Well, that's a great question, Earl. Here, if you want to look up, there's a list of the most common sports injuries, and there are about 5 that typically occur in adolescence. The first are sprains, typically an ankle sprain, but a sprain is an injury to the actual ligaments, and that usually happens with rolling. So like an ankle roll, or maybe just you're twisting the wrong way and you don't actually fall or break anything, but you pull the ligament so that you have a sprain. And this kind of happens with like running, very high speed running and twisting or juking on the field, and then your ankle might buckle or your knee might twist, and then you have a sprain. Whereas the next type of injury is a hairline fracture. Hairline fractures are usually because the force of impact is not so great until you're probably like college level sports or maybe high school level. But before then, you're falling on an outstretched hand, or you're falling incorrectly, and then you would suffer a hairline fracture in the bone. Next is a growth plate injury, and growth plates are actually the spaces between the children's bones. They are not fused yet. So in an adolescent, as you're growing, your growth plates are still open. And when they are still open, you have repeat trauma to them and inflammation. So things like apophysitis or osteochondritis, which is Osgood-Schlatters disease. You might have, these are all inflammatory effects on the growth plates that are not harmful. They're not actual injuries that need to be repaired, but they do result in a lot of pain, and they do require rest or abstention from the sport. Abstaining from the sport. The next is a shin splint, and that usually occurs with like long distance running or sprinting. And again, that's inflammation along the tibia, the lower leg. And then finally, ACL tears, which we hear about all of the time, and those are the most common. And that is usually from running and twisting. And that tends to happen more commonly actually in adolescent girls in soccer. More so than the boys in football. And the reason for that is that the girls go through puberty a lot faster, and they tend to be a little more flexible and turn and juke and pull the ACL. So those are the most common injuries that you'll find. And really the way to prevent that is taking 1 or 2 days off during practice or training. You need time for your body to recuperate. So practice usually should be at most 3 times a week. During a season, you should have 1 month off for your body to rest and adjust. And then, of course, as I mentioned before, stretching before and after practice and games will help keep you a little more limber and help prevent these types of injuries. The next question we have is coming from Facebook, and it's from Ling. Hello, Dr. Constant. I take my workouts very seriously, and I like going to my CrossFit gym in the early morning. But lately, I've been seeing very young first and second graders working out with their parents at my gym. I'm all for physical fitness, but that seems a little extreme, or am I too old? Well, Ling, I understand what you're saying. Hopefully these kids are not actually doing your CrossFit workout. Accompanying your parents to the gym could be fun. It's a family activity. You're promoting good habits, good healthy lifestyle, and you're teaching by example. So I really do encourage that. What I do hope is that these young children are not actually participating in the exact same routines that you are during CrossFit. Children should actually, we do encourage plyometrics and strength training and muscle building and muscle recruitment, but not actually using weights yet at that age. And of course, not working out so intense where it's, over an hour and they're burning more calories than they should, or maybe suffering from dehydration because they didn't properly hydrate. So, there is a limit to what they should be doing in CrossFit, but absolutely being with your parents and doing maybe a modified workout that's age appropriate is commendable. Okay, so just to recap, it is very important to stretch before and after practice or games. It is also recommended, in order to prevent injuries, to build your muscles, meaning strengthen them. And that can be from plyometrics, it could be from resistance training, and if age appropriate, light weights. And when I say light weights, I mean it's better to do lower than what you can maximize at, and just do more repetition so that you're actually building your muscles. And these things will keep your body in good shape and strong in order to prevent any type of injury in competitive sports. It looks like we have another question coming in, and that is coming in from the All Health TV app. This is from Caroline. Dr. Constant, both of my kids are athletes. They've played soccer and gymnastics ever since they were in preschool. They want to move to full contact sports like football and girls basketball. They're only 5 and 7. Is that too young to play competitive high impact sports? Well, Caroline, that's a great question. So there are a couple things to consider when you plan on enrolling your children in high impact and competitive sports. Number one, you want to make sure your child is mentally and emotionally prepared to enter. There is an age where they are just too young to even understand the strategies behind competitive sports and to make quick decisions and to understand how to outmaneuver. Sometimes it's just a little bit too complicated for their age group. So if they're able to understand that and understand strategy and game and skills, that's number one. Secondly, you want to make sure that they also understand competitive sports falls on the entire team. And sometimes when you're too young to understand that, you think that you are solely responsible for the good and the bad outcomes of your team. So your child needs to be emotionally ready and prepared to understand the pitfalls of losing and, the joys in winning, but also understand that this falls on the team and the coaching, and there are many factors, and it doesn't only fall on them. Finally, you want to make sure that they are physically prepared. You want to make sure that they're matched up against kids that have the same body type and that they are physically prepared to take part in these sports. Contact sports such as football might not be the best option for a 7-year-old, but they certainly can start. A lot of the leagues now in football and basketball and some of the contact sports have modified the game so that it's age appropriate until they are ready to be a little more intense. So I would look into that for your child. Okay, it looks like we have another question. This question is from Mufasa. Hi, Dr. Constant. I heard a rumor recently that has me a little concerned. Is it true that weightlifting and certain exercises can stunt a child or teen's growth? Would love to get your thoughts on this. Well, Mufasa, there is no evidence that shows that weightlifting or that weightlifting and other exercises will stunt growth. There is no evidence that's shown that. It is definitely important to use weights that are appropriate for your body type and for your age. And yes, it is recommended, like I mentioned before, to use light weights and more repetitions than maximizing out on weight and doing maybe like one rep or exploding. And that's more because it's more likely to cause injuries, not necessarily stunt the growth, but can cause terrible injuries such as herniation, such as fractures, such as pulls, slip discs. Those are things that you really want to avoid and you want to prevent, but it will not stunt the growth of your child. Okay, I think we have another question coming in from Facebook. Let's take a look. This is from Jeremiah. Hey, Dr. Constant, how important is it for young athletes to have regular physical checkups to prevent and address injuries? That's a great question, Jeremiah, especially since I'm a pediatrician and I offer these physicals in my office. It is important to go to your annual checkups every year. And this is because as physicians, we don't only give vaccines. We check you from head to toe. We want to make sure the blood pressure is within range. We want to make sure that the heart rate is within range and the child isn't suffering from maybe an underlying heart condition that we didn't know about or that didn't present itself until the adolescent years. Some teenagers have high blood pressure, and we want to control that before you're playing an intense sport. So we check blood pressure, we check the heart rate. We also check blood work to make sure that, there isn't a thyroid issue or any type of an electrolyte imbalance. It is very important we check for scoliosis, which of course presents after the age of 11. And if you have scoliosis or maybe rapidly advancing scoliosis, we could prevent you from getting a terrible injury or a herniation or worse by identifying the fact that you have curvature of the spine and you might need intervention. So there is a lot to examine during a physical exam. And absolutely, I encourage you, not only your athletes, all of your children to get annual exams, but yes, most specifically athletes should be evaluated every year to make sure that they are fit and prepared to play sports. Okay, we have time for a few more questions. Let's see. It looks like I have a question from Lanny. Dr. Constant, are there specific guidelines for safe participation in contact sports to help minimize injury risks? Yes, there aren't specific guidelines, but as I mentioned before, usually most leagues for the sports will have guidelines and safety guidelines that are in place in order to minimize injuries on the field. And this, as I mentioned, are things very simple, such as, no heading the ball. In females, in girls soccer under the age of 11, you can't head the ball, meaning use your head to hit the ball. In youth soccer, you can't side tackle because you can obviously tear an ACL or tear somebody else's ACL. In football, you can't spear the ball. In hockey, they say that you can't check, and same thing with lacrosse. You can't body check yet. So these are all things that are in safety measures that are in place to protect the children and minimize injuries. But truly, the best way to minimize injuries is like we've mentioned before, is keeping your body safe and healthy, building muscles, exercising, staying fit, getting rest, taking time off, and most importantly, if you're hurt or you are suffering from any pain, do not play. There's nothing wrong with taking time off and skipping a game or skipping practice if you're in pain or you've hurt yourself before. You should not feel any pain or strain or nagging pain when you're participating in sports or when you're practicing. That means that there is an underlying injury. So you have to take care of yourself. You have to regroup, recharge, and rest in order to prevent further injuries. Let's see if we have any more questions coming in. Oh, yeah, we do, from Myra. Hi, Dr. Constant. What are the best strategies for managing and treating muscle strains and pulls in young athletes? Oh, that's a great question, Myra. I get that question all the time in my office. So the best way to manage and treat these strains are, first of all, rest. Most important, your child should stop going to practice. Stay home and rest. And what you want to do is first you want to apply heat. So heat is going to vasodilate. It's going to relax the muscles and allow you to, offer some type of therapeutic massages just to kind of relax the muscle strain. And then what you want to do is offer your child anti-inflammatories, of course, that will not only minimize the pain, but decrease the inflammation in the area of injury. And then you're going to want to, after you've applied the heat, you've massaged, then you're going to want to exercise the muscle. Believe it or not, when you have a sprain, or a strain, you don't want to just be completely inactive. The most important thing is to now build that muscle back up. And the way to do that is by doing very low impact exercises to build the strength back in that muscle that has been injured. And after you do that, you will then apply ice to cool it off and to relieve any of the inflammation that has been surrounding the area. Because imagine you're already injured, you had a massage and you exercise, so now there's more inflammatory markers. So you'll apply the ice for a cool down. Okay, and so another question that, some parents have asked me in the office are, what are the signs of overuse injuries in children? And that's a great question. Oftentimes I'll have a kid come in and just say, I'm limping. It's your limping child. I've been limping. I don't know what happened. I didn't do anything. There wasn't an injury that I can remember. I've just been limping. And every time I walk, it hurts more and more and more. It might be in the heel. It might be in the knee. Sometimes it's in the hip. And that is a perfect sign of an overuse injury. There's just been inflammation and micro injuries that have been going on for so long that all of a sudden there's this pain that causes limping or the inability to bear weight in that area. And so actually, as a physician, I'll sometimes palpate that area and I'll be able to elicit pain. And that's a clear sign that there's an overuse injury. An X-ray will be negative. An MRI, of course, will be negative. There's no indication for imaging. It really is just a physical exam with a clinical history. And that's the way we would diagnose an overuse injury. And in that event, I would tell you, please, please, please don't go back to practice. Rest, rest, rest until the inflammation has gone down. Sometimes we'll offer anti-inflammatories to help. And that's usually what we'll do for the overuse. I hope I was able to help and answer these questions. I'm Dr. Scarlet Constant, founder of Constant Care Pediatrics. I'm right here in the heart of Kendall. If you have any questions and you'd like to contact me, you can always go to my website, constantcarepediatrics.com, and ask any questions if you have any concerns, and I'm happy to help. Hope this was informative, and have a great day.
Thank you for listening to the Health Channel podcast. We hope this information has been useful. However, please remember that only your doctor can advise you about what is best for you. Do not start, modify, or suspend treatment based on anything you have heard on this podcast. Please join us again soon.